Hi, I am Cindy Rubin. I'm a pediatrician and breastfeeding medicine specialist, and I have a practice called In Touch Pediatrics and Lactation, which is a home visit practice outside of Chicago in the western suburbs. Fever. Fever is on a lot of our minds right now. We are seeing a lot of viruses running rampant right now, and kids are getting pretty sick, and fever is often a part of that illness. It can be scary when your kid gets a fever. So, how do we know when to really worry and what we can do? So, fevers, first of all, are not going to cause anything bad to happen to your kiddo. They can be scary because your kiddo feels awful and they feel so hot and their heart's beating fast and they're sick. But nothing bad is going to happen from the fever. In fact, the fever is actually, by changing the body temp, helping to fight that infection off. So it's actually helping. The only problem is that fevers make you feel miserable. And when you feel miserable, you may not want to eat, you may not want to drink. And that's often what is worrisome. So, what you will hear from many pediatricians is treat the kid, not the number. So the number doesn't matter to us. Even fevers that are on the higher side, 103, 104, 105 even, they don't scare us as pediatricians. What we worry about is, how is your kid doing? Are they drinking fluids? Are they arousable, alert? They understand who you are, or they're not completely out of it. You can't wake them up, or when you do wake them up, they seem like they really don't even know who you are or where they are. Are they having any trouble breathing with the fever? Are you able to get the fever down a bit if you try and help them feel a little bit better? Those are the things that we usually look for to help us decide when we're worried. So if you have a kiddo with a fever, again, treat the kid, not the fever. If they look miserable and they're not smiling, not playing, not drinking fluids, which is super, super important when kids are sick, then you can give them a dose of a fever reducing medicine. One is acetaminophen, or otherwise known as Tylenol. Another is ibuprofen, which is okay for kids if they're 6 months or over. You can give a dose of medicine, and usually within 30 to 60 minutes, that medicine will start to kick in. And hopefully that will bring the fever down a bit, enough for your kiddo to feel a little bit better. It also will treat pain if they have some pain along with that fever. Oftentimes, we know as adults that we'll get a headache when we have a fever, or the virus that's causing the fever or the illness that's causing the fever could be causing itself a headache or sore throat or other sorts of pain, tummy pain, that the medicine may help as well. So, after about an hour, are those things looking a little better? Is your kid a little perked up? A little bit at least, able to maybe rest more easily, more inclined to drink fluids. If those things have improved, even if their temperature is not normal, as long as those things are improving a little bit, then that's reassuring. If despite a fever, whether a kiddo has a fever or not, your kid is not drinking, you can't get them to drink anything, and it's been maybe 8 to 12 hours since they've even peed, especially for the little ones. Or if they are just sleeping like for 24 hours so that you can't even wake them up to get them to drink, then that gets me worried. Our heart beats a little bit faster and we breathe a little bit faster when our temp is up. That's normal. When the temp goes down a bit, those things should ease up. So if you feel that the temp has gotten down to normal and your kid is still breathing very fast, or their heart seems to be beating super, super fast and they're still acting like super, super fussy, then that could be a sign that they need to be seen. So, in short, when do we worry? So, we worry when the fever is either making your kid miserable to the point where medicine is not even helping with that. It's not helping your kid perk up even a bit so that they're maybe a little bit playful or drinking a little bit. So your kid's not drinking fluids, not giving you a pee every 8 hours or so if it's a baby or a young child, and at least twice a day if it's an older kid. If your child is having persistent trouble breathing, breathing very fast, or heart is beating very, very, very fast and doesn't come down with treatment with Tylenol or ibuprofen. And then the other big thing is length of days of the fever. So any time a fever is on the fifth or more day in a row, your pediatrician will want to see you. Also, if in younger babies, it may be a lower threshold. So even after a few days, we may want to see them, especially if they can't talk to us and tell us what's going on at all. Another thing is we're always just happy to see your kid, whether it's virtually or in person. If you're worried, I may say, I don't need to see your kid until it's been 5 days. But if you're really anxious about it, or there's something about your, sixth sense that's telling you my kid needs to be seen sooner, by all means, give us a call. These are rough guidelines, and we know that parents worry, and it's never wrong to contact your doctor, and they can help you to triage and figure out whether your kiddo really needs to be seen, or maybe you can just have a conversation to figure things out and get a better feeling for when to worry. Another thing that's very important is if you have a baby who is less than 2 months old, then any temperature, so 100.4 or more, ideally taken rectally, will need to be seen urgently. You can call your doctor, but they very well may send you to the emergency room for your baby to be seen, because fevers are just a little more worrisome in those younger babies, and it's harder for us to know what's going on. So it usually requires an in-person evaluation, which may even require some more investigations like lab work and things like that. So I guess the crux of the matter is there's always somebody to help you if you're worried about your kid in a fever. But remember that the fever itself is not dangerous, and you can often treat those symptoms at home, help your kiddo feel more comfortable with acetaminophen or ibuprofen. Keep them hydrated. That is very, very key. We don't even really care about eating as long as your kid is drinking when they're sick, still peeing, not having labored breathing, and generally, has good moments and bad moments, but, it does have those better moments, hopefully, when their fever's down a bit and they can be a little bit more playful and more responsive. Excessive sleepiness or excessive fussiness, like hours of fussing that just really cannot be consoled with anything, including just holding them, rocking them, anything like that. Those are concerns. So again, call your pediatrician if you're worried, even if they don't, check any of these boxes off. We can always talk you through it and hopefully reassure you, and see your kid in person if they need to be. We'll get through this cold and flu season, I promise. I can't promise that your kiddo won't get sick during it, but you have help from your pediatrician, and that's our job. We want to hear from you if you're worried. All right. Have a wonderful day.